Okay. My name is Tina Segura, and I'm a staff attorney at the Cancer Legal Resource Center. And today's webinar is, as the topic suggests, how do I sign up for or change my enrollment in Medicare? First, what is the CLRC? I mentioned that I'm the staff attorney at the Cancer Legal Resource Center. Some of you may be familiar with the Cancer Legal Resource Center already. If so, great. And if not, for those of you who aren't familiar, this is our mission. It's basically to provide information and resources to people with cancer and those affected by it. We don't typically provide direct legal representation, but we focus on the educational model. On our website, which is cancerlegalresources.org, we have a lot of free resources, so I invite you to browse around and take a look. We also have an online intake form on our website, or you can just type in clrcintake.org if you would like to be provided with information and resources customized to you. All of our resources are free. We will ask you some basic intake questions, which does include your income, but that's just to match you with the appropriate resources so that we make sure not to give you resources that are irrelevant to your situation. So if you are on this webinar, you probably have access to the internet, so if you have a question about a specific scenario or want to know what you can do or how you can receive help, please fill out an intake. If you know someone who doesn't have access to the internet and you're not able to help them or they're not able to get help, they can leave a message on our phone number there that's on the screen, and they can ask for an intake and someone will give them a call and help them fill out that online intake. So our services are free regardless of income. And just real quick, if you have questions about today's presentation, type them in the question box. Like if I went over a slide and you had a question about that, type that in the question box. But if you want to know specifically about a resource for your situation, we'd ask that you please fill out an online intake form so that we can get all the data we need to about you and provide you with the most relevant customized resource. And if I haven't mentioned this already, our services are free regardless of your income. And I will be making this whole presentation available online at some point after today's webinar. So you will have access to the slides and everything that I say that's recorded here today. Okay, our website has a lot of educational materials, including this patient legal handbook. This is the cover of our patient legal handbook. It basically has legal information related to a lot of different topics. So we introduce some of the legal concepts regarding cancer and employment, cancer and health insurance, estate planning, if you're wondering about pre-existing conditions, if you're wondering about Medicare, how to ask for time off of work, your right to accommodation in the workplace, landlord-tenant information, some just basic information. So we encourage you to check out our website, download a free copy of this. If you are a healthcare provider and you want to order bulk copies of these printed, get in touch with me after this webinar, provide your email address, and we can talk about large distribution of these printed materials. But the free versions in English and in Spanish are on our webpage for download. And if you are able to financially and you want to contribute to helping us get these distributed to individuals, that link below is to donate. $1 gets a patient legal handbook into the hands of someone with a newly diagnosed person. All right, moving along beyond the CLRC. So hopefully you know what CLRC does, the type of things that we help with. Check out our website. Don't have time to go over it all, but one of the topics that we help with is Medicare. So I'm going to go over some introductory things about Medicare. And I know Medicare is a huge topic and it can be very confusing. So I just want to go over some things that'll hopefully make it a little bit more clear for you, for yourself, a family member, or if you're a healthcare provider for your patients. So today's presentation is going to cover enrollment into Medicare, some basics about Medicare first, and then when to sign up for Medicare and how to sign up for Medicare when you're first eligible, and then why it's important to do so when you are first eligible. I'll talk about open enrollment and a little bit of how Medicare works with other insurance. So you'll know generally how Medicare works after this presentation, but don't expect to be a Medicare expert after this because we do only have an hour, and even experts have a hard time with Medicare. So I'll include some resources at the end if you need additional help after this webinar. All right, what is Medicare? Essentially, it's a federal health insurance program. It was first introduced in 1965 and gradually expanded over time. It's federal health insurance that consists of Part A, B, C, and D, and it's financed by general revenues, payroll tax contributions, beneficiary premiums, and other sources like state payments and things like that. Okay. Who is eligible for Medicare? If you are 65 or older and entitled to Social Security retirement benefits, either on your own accord or through a spouse or former spouse, or for those under 65 who have received SSDI, Social Security Disability Insurance, for 24 months, or people getting dialysis for end-stage renal disease, or those who need a kidney transplant. So these are generally the populations of individuals who are eligible for Medicare. And I have to introduce this slide every time I talk about Medicare because a lot of people will call us and talk about their Medicaid when really, after probing with a couple of questions, we find out they're on Medicare. So I just want to introduce the difference between the two. Sorry for those of you who already know this, but for those who don't, key difference, there is a difference between Medicare and Medicaid. Medicaid is a federal state program that provides health care coverage to low-income individuals. And it provides supplemental coverage for nearly 10 million Medicare beneficiaries with low incomes and modest assets. A person may meet Medicaid's income and asset requirement and Medicare's eligibility requirements, so you can be eligible for both. And these people are called Medi-Medi or dual eligible individuals. I'm not going to go into great detail about that, but just a heads up, Medicaid is typically for people with low incomes and limited assets, and it differs by state. Whereas Medicare is a federal insurance program, it's the same program nationwide, and it's not free. Participants pay deductibles for parts of their coverage, and I'm going to explain some more of that. But as you can see, there is some overlap, so you can be eligible for both. Okay, what does Medicare cover? This is a little pie graph that shows what types of things that Medicare paid for in 2015. So a lot of hospital inpatient services, and then about a quarter of the population who was enrolled into Medicare had a Medicare Advantage plan, which you'll understand. So it has, essentially Medicare has 4 parts, and I'm going to go over those. Part A of Medicare covers inpatient hospital stays, skilled nursing facilities stays, hospice care, and some home health visits. Hospice, just a quick note on this, I'll go over a little more later. If you elect hospice, that is covered by Medicare Part A, that means you're not going to get services such as treatment to get well. It's one or the other. So hospice coverage is included in Part A if you meet the requirements to be eligible for hospice. Skilled nursing facility care is covered. Just a note, custodial care, which is things like help with walking, eating, household help, which is essentially not medical skilled care, is not covered if the bulk of services are things that are not medical medical care. So just a note, there is a difference there. And somebody just asked if you'll get copies of the slides. They will be available on our website. This whole presentation is being recorded, so thanks. And then Part A and B, which I will explain shortly, are what's called Original Medicare. So this is Part A of Original Medicare. So Part A is generally free. What I mean by that is the premiums are free. So you won't pay a monthly cost for Part A, for the most part, unless you don't have enough Social Security work history. For those who did have to pay, it ended up being $413 a month in 2017. So if you didn't have enough credits with Social Security, the idea is this is free for people who already worked enough and paid through their taxes. So if you didn't have enough credits with Social Security, you could sign up and may have to pay a monthly premium, which can be really costly. But for the most part, people don't have to pay a premium for Part A. People sometimes have the idea that Medicare is entirely free. That is absolutely not true. And some people are very disappointed when they do find this out. Premiums are free, but there are other out-of-pocket costs. So there are, just like any insurance, there are deductibles and co-insurance. And I won't go over the details of what every deductible is and co-insurance, but essentially there's a deductible for each benefit period. And if you need to stay in a hospital, the amount of co-insurance you pay per benefit period varies based on the length of your hospital stay. So for the first 60 days, it's generally $0 of co-insurance, and then if you have to stay longer than that, you would have to pay a co-insurance per day. And then it resets, the benefit period resets. It begins the day that you're admitted as an inpatient or at a hospital or skilled nursing facility, and it ends when you haven't gotten any inpatient or hospital care for 60 days in a row. And the prices of copays for skilled nursing facilities versus hospitals are different. So again, the premiums are free and the copays and co-insurance are not free. All right, Part B of medical insurance. Part B functions like medical insurance and covers the following. I'm going to pause for 1 second. Okay, Part B covers the things you see on the screen: doctor visits, outpatient care, certain home health visits, preventive services, x-rays, lab tests, cancer screening. Basically, this is the medical insurance component. So Part A and B are Original Medicare, and these Part A was the hospital insurance benefit, Part B is the medical insurance benefit. So Part B is not free. Part A premiums are free for most people. Part B is not free. The premium is about $134 per month in 2017. Depending on the individual, it could be slightly more or less. It's less if you have to pay with Social Security benefits. And then after your deductible is met, so there's a premium per month of $134, and then there's also a deductible. Just like a lot of health insurance plans, you pay $183 per year for your Part B deductible. So that comes out of pocket by the beneficiary. Once you pay that $183 deductible, you typically pay 20% for most services, doctor visits, outpatient, durable medical equipment, and then there's no copay for wellness visit or preventative services with certain ratings. These are the preventive services covered under Medicare Part B. And so essentially, if you have to get certain preventive services, there's a chart that allows you to get these preventive services free, not as often as you wish, but as often as recommended, and Medicare follows this guideline. The Affordable Care Act made several preventive services that are now covered by Medicare. The Affordable Care Act made these services available with no copays or no deductible. So if you can read what's on the screen here, this is a list of preventive services covered by Medicare. The details on what age these screenings are covered for people or how often, I'm not going to go into, but when you enroll into Medicare, you'll get a booklet that explains all the details, or you can view that booklet on the Medicare.gov website. I mentioned 80% or 20%. The 80-20 rule in Medicare, a lot of people already know this, but for those who don't, for original Medicare Parts A and B, you pay the deductible, which I mentioned, and then your plan starts to pay 80-20. So you pay 20%, Medicare pays 80%. And then Medigap plans, which I'll talk about shortly, help you pay for the 20% of these Part B insurance costs that are not covered by providers. So I'll talk about that shortly too. So I mentioned what is essentially covered by Parts A and B, but what is not covered are the things on this slide. Experimental procedures, tests for glasses, hearing aids, prescription drugs, dental care, most immunization shots, and services outside the U.S. And custodial care. I mentioned this already, but custodial care that's given by a medically unskilled person to help a patient with the tasks of daily living, walking, bathing, dressing. Medicare will not cover the cost of the service if it's mainly custodial. And then these other items are not covered by Parts A and B of Medicare. Medigap policies are called supplemental policies. Now that you know Medicare covers only 80% and you would be responsible for the remaining 20%, Medigap plans are something you should also know about. Medigap plans are known as supplemental insurance, and they pay some hospital and medical costs not covered by Parts A and B, like deductibles, copays, coinsurance. These Medigap plans are offered by private insurance companies. These are not federal government provided, so you will pay a premium for Medigap plans and buy them through a private insurance company. And of course, the policies and prices vary by insurance company, just as they do with car insurance or any other insurance. So it's important to compare premiums, compare the coverage and costs. And generally, you have to be enrolled in Medicare Parts A and B to buy a Medigap plan. Medigap policies do not work with Medicare Advantage plans. I'll explain that a little bit here. So if you have a Medigap policy and you want to join a Medicare Advantage plan, you will want to drop your Medigap policy. And then Medigap policies do not cover prescription drugs. That's something else that I'll talk about shortly. Okay. One unfortunate thing is that disability and reverse age discrimination are huge problems for people under 65 who are looking for Medigap plans. What I mean by that is that these plans are run by private insurance companies in the business of making money, and these plans can charge a higher rate for people under 65 years old. If you think about it, the insurance companies know that if you're under 65 and you have Medicare, then they know that you're probably linked to Medicare because you're on SSDI. Remember in the beginning I said that you can get Medicare if you're 65 or older, end-stage renal disease, or under 65 and have a disability and have been receiving SSDI. So these private insurance companies who sell Medigap plans, they know that. And so if you're under 65, they know that you're a person with a disability. Medigap plans who sell insurance plans to people 65 or older, it's, you know, it's unknown whether the person's good health or has a lot of health issues and is going to cost that plan a lot of money. So federal law does not require Medigap plans to be sold to people under 65. So these plans can essentially turn people away if they're under 65. Basically, they've figured out that if you're under 65 and getting Medicare, you probably have a disability. You do have a disability. So they can figure that out and likely raise the cost of your insurance coverage or deny people altogether. Some states have laws requiring private companies to offer Medigap policies to people under 65, but they don't necessarily require the plans to be affordable. So that's just one thing to be aware of if you're under 65 and a Medicare recipient looking for Medigap policy. All right, I talked about Medicare Part A and B and a little bit about Medigap. So Medicare has 4 parts, A, B, C, and D. You know a little about A and B now. Part C, Part A and B is original Medicare. Beneficiaries can choose between either original Medicare, which is Part A and B, or Part C, which is called Medicare Advantage. Part C is where beneficiaries enroll in a private health plan and receive all Medicare covered Part A and B benefits. So you'd still get the hospital benefits, you'd still get the medical coverage benefits, except it would be called Part C instead of Parts A and B. And typically in Part C plans, it often includes prescription benefits. Part C plans offer the same basic coverage as original Medicare, only through a network of private insurers. And a lot of people now have Medicare Advantage plans instead of original Medicare. And again, these plans are offered by private insurance companies, so they do vary. A lot of them include not only what's in Part A and B, but also prescription drugs or vision benefits or hearing benefits or even gym memberships. And just like original Medicare, the beneficiary is responsible for their annual deductible, co-pays, and co-insurance. There are advantages and disadvantages to Medicare Part A and B versus Medicare Part C. So I'll talk about that shortly. You may have to pick a doctor in the Advantage Plans network. Unlike Medicare Parts A and B, original Medicare, you can go to any Medicare provider. With Part C, you may be more limited by having to pick a doctor in the plan's network, just like any other HMO or PPO, and you have to pay more if you see doctors out of network. And again, not all Advantage plans are the same, and they vary a lot from state to state, even from county to county. I mentioned a lot of this already. Medicare Advantage plans can all be different. One advantage is that there are usually set co-payments to see a doctor, and Advantage plans have a yearly limit on your out-of-pocket costs to medical services. Once you reach this limit, excuse me, you pay nothing for covered services. The limit might be different between Medicare Advantage plans, and they change each year. So that's something else to consider when you choose a plan. And you could be eligible for additional benefits or coverage beyond what original Medicare Parts A and B costs. So when you're thinking about enrollment, obviously there's a lot to consider. I don't have time to go over every consideration to make when you're choosing plans, but these are just some things to think about and start investigating a little bit more. You can shop around for different Part C Advantage plans. You can compare original Medicare Parts A and B with Part C. Check your doctors that you're currently going to see which Medicare Advantage plans they accept. Find out whether they are Medicare providers, whether they accept Medicare. So these are just some things to keep in mind. Now I want to talk about enrollment. I'll pause for 1 second. Okay, so let's talk about Medicare enrollment periods. There is what's called an initial enrollment period for Medicare. I mentioned people under 65 can get Medicare, people over 65 can get Medicare. So if you're about to turn 65, someone turning 65 has an initial enrollment period that begins 3 months before their 65th birthday month, and it goes through 3 months after your 65th birthday month. So this totals up to be 7 months surrounding your 65th birthday, 3 months before, the month of, and 3 months after. You have that window to enroll into a Medicare plan, whether A and B or Part C. If you're under 65 and you have a disability and are collecting SSDI benefits, you will be automatically enrolled after 24 months. That's a really long time to go without health insurance. So if you are going to be collecting SSDI, just be aware that if you're under 65, if you're going to be collecting SSDI, Medicare doesn't kick in until after 24 months, and you'll be automatically enrolled into Medicare. So these are some things to keep in mind. This is your initial enrollment period. Special enrollment, if you didn't enroll in Medicare during your initial enrollment time, there's also a special enrollment period. If you're still working at age 65, you might not want to enroll in Medicare because you have employer coverage. So if you have employer coverage, there's an 8-month special enrollment period to sign up for Medicare Parts A and B. The 8 months begins the month after the employment ends. So if your employment's going to end in January, you have until September to elect to enroll into Medicare via special enrollment, or 8 months after the group health plan insurance based on your current employment ends. So if you lose your job or quit, or if your health insurance policy ceases to exist at your current employer, whichever happens first, you have an 8-month special enrollment period. So usually you don't pay a late enrollment penalty if you sign up during special enrollment. I'm going to talk about those penalties shortly. Then there's also a general enrollment and open enrollment. You may have seen a lot of ads recently about this open enrollment, because it's currently open enrollment for Medicare Part C and D. General enrollment, sorry. It's open enrollment. There's a general enrollment period between January 1st and March 31st each year for Medicare Parts A and B. If you didn't sign up when you were first eligible and you didn't have a special enrollment period, or you missed it, you can always sign up during this period, and your coverage would start July 1st. You'd have to pay a higher premium if you get a late enrollment penalty, which I'll talk about shortly. And to ensure that your Medicare enrollment is problem-free, it's encouraged to contact your local Social Security office within 3 months before you turn 65, because if you fail to enroll within this 3-month period, you'll likely end up paying a late enrollment penalty. And then I mentioned general enrollment for Part A and B. And then for fall open enrollment, what's happening right now through December 7th is enrollment opportunity for Part C and D plans. I'll talk about Part D plans, but that's the prescription benefits. Okay. Medicare Part B, going to talk about that here shortly. Okay. All right, Medicare Part B. Most of the time, if you don't sign up for Part B when you're eligible, you'll have to pay a late enrollment penalty, which I just mentioned. So here's how the penalty works. This can be kind of tricky to follow, so I'll try my best to make it as simple as possible. So let's say, for example, if a person was eligible in 2011, but they were eligible in 2011 when they turned 65, but didn't sign up until 2017, this is how the penalty would work. In 2011, the Part B premium was $96.40 a month. And the rule is that if you enroll late, you pay 10% premium for each year that you were late, in effect for life, added to your Part B premium. So if someone didn't sign up but was eligible in 2011, what did the Part B premium cost in 2011? It was $96.40. So multiply that by 10% is $9.64. That cost, and it's been 6 years since they were first eligible, $9.64 per month times 6 years that they didn't sign up for Part B and they could have, equals $57.84 added to the Part B premium for life. So when I say it's important to enroll when you're first eligible, that's exactly why. I did a little bit extra math, and that ends up being $694 per year in penalties for someone who was eligible for Medicare in 2011 and signs up in 2017. So if you're going to be late on enrollment, don't be 6 years late, because that's going to really add up and result in a lot of late enrollment penalties. So again, if you don't sign up when you're first eligible, 10% of the premium cost in whatever year you were eligible, multiplied by however many years you didn't enroll, added to your premium for life. I hope that makes sense, because that really used to confuse me when I was first learning about Medicare. Okay. So Part B, I wanted to explain how that works with group health coverage from an employer. I mentioned that a lot of people don't want to sign up because they have employer-based coverage, but some people do want to sign up while they have employer-based coverage, and if you do so, here's how that would work. If the beneficiary is still covered under an employer group plan when they turn 65, usually the group plan becomes the primary insurance and Medicare becomes the secondary, but that all depends. If you're covered, I'll explain that real quick, but if you're covered under a group health plan based on your current employment, you would be eligible for that special enrollment period I talked about a couple slides ago. As long as you or your spouse is working and you're covered by a group health plan based on that work, you'll have that 8-month special enrollment period to sign up for Medicare Part A and B that starts the month after the employment ends or the month after the health insurance ends. So just wanted to remind you of that. If you have other health care coverage and you sign up for both, here's how it works. Pretty simple, straightforward. If you're covered by an employer and the employer has 20 or more employees, then the group plan becomes the primary insurance and Medicare becomes the secondary insurance. Medicare would become the primary payer if you have an employer that's a small company, less than 20 employees. There are some limited exceptions to that, but for the most part, it's the group plan becomes the employer plan, becomes the primary insurance. Medicare becomes secondary unless the employer is a small employer of 20 or less. I mentioned dental care isn't covered by Medicare. So if you have a Part C plan, or if you're thinking about it, some of those plans offer dental options. So that's something to consider when shopping for a plan. Medicare doesn't cover like routine procedures such as supplies, cleanings, fillings, tooth extractions, dentures, dental plates, or other services. So dental care can be especially difficult to access for people living with cancer. I mentioned Part D, so just quickly explain what that is. It's a prescription drug benefit a lot of people have heard of, but for those of you who haven't, Part D adds prescription drug coverage to original Medicare. Remember, Part A and Part B is original Medicare. Part D plans are offered by insurance companies and other private companies approved by Medicare. All people on Medicare 65 and older and under 65 have access to the Medicare Part D benefit through private plans approved by the federal government. You can enroll in standalone prescription drug plans to supplement original Medicare, or you can enroll in a Medicare Advantage plan that includes Part D coverage, prescription coverage. So enrollment in Part D is voluntary, and again, they also come with an annual deductible. Once you meet your deductible, your plan will usually pay about 75% of your prescription costs. And open enrollment for Part C and D is now through December 7th. So that's something to keep in mind. Again, sadly, there is a late enrollment penalty if you're eligible for Part D. And you don't sign up, for each year you go without a Part D plan, there is a penalty. It's 1% instead of 10%, but it can still really add up. So it's 1% of the average national premium the year you join. And you multiply that by the number of months that you waited to join, rounded to the nearest 10 cents, whether up or down, and that's added to each Part D premium. So just as an example, in 2017, the average national premium this year, let's say someone joins this year, in 2017, the average national premium was $35.63. 1% of that is 35 to 36 cents. Rounded up to the nearest 10 cents, 40 cents. And let's say you went 24 months without joining. 24 times 40 cents equals $9.60 added onto your monthly Part D premiums for life. So again, this is just to encourage people to make sure to enroll when you're first eligible, or be aware that there will be late enrollment penalties. All right, that was bad news. Now for the good news, I think. Part D prescription drug plans must cover most cancer medications, anti-nausea drugs, antidepressants, immunosuppressants, but not all plans are the same. They all have different formularies, premiums, co-pays, requirements, etc. So plans can and do vary in terms of their specific benefit design, limits, formularies, and how they work. So it's just important to shop around for different Part D benefits. Okay, back to the bad news about Part D. I just wanted to talk about this donut hole. Before I knew about Medicare, a donut hole was just the tasty leftover of a donut. But now that means something different to me. What I mean by a Medicare donut hole is a Part D prescription drug coverage gap. You may or may not have heard about this, but I just want to make sure that everyone's aware of what this means. Not everyone will enter the coverage gap, known as the donut hole. Here's how it works. So I mentioned that most Part D plans cover about 75% of prescription drug costs. For the most part, that's true. Where you see this initial coverage period, I don't think my cursor is showing up for you guys, but this initial coverage period where enrollee pays 25%, plan pays 75%. That's true until both the beneficiary and the plan have reached the initial coverage limit, where $3,700 have been paid out in total drug costs. Once you reach that threshold, you're no longer paying 25% and the plan's no longer paying 75%. You go into this donut hole that's called the coverage gap, where you essentially pay around 50% of drug costs and the plan pays about 50%. For brand name drugs, you will still pay about 40%, but you'll get a manufacturer discount and the plan will pay even less. Once you meet yet another threshold, another 5,000 or so, 4,000 or so in coverage total, then you get back to paying about 5% of drug costs, but you have to spend a lot of money to get back there. So by 2020, the coverage gap will gradually close and you'll continue paying 25% of your prescription drug costs. Medicare pays 75% without going into that coverage gap. But I just wanted to explain this coverage gap because not a lot of people are aware of it. What happens, most people become aware of this coverage gap when they enter the coverage gap and start paying more for medications. People become surprised when they're like, I used to get this medication for $5 and now I'm paying $55 for this. What is going on? And this is usually the explanation for that. Of course, there's a million other explanations that are possible, but that's unfortunately the way that a lot of people find out about the coverage gap. So I just wanted to shine some light on that. I mentioned that the coverage gap will be reduced by 2020. So we're over here in 2017. The closer we get to 2020, the less you pay when you enter the coverage gap. Right now, beneficiaries are paying 40% of drug costs when they enter that coverage gap. And by 2020, they'll be paying 25% for medications, just as they would be in the beginning before reaching the coverage gap. This coverage gap is being closed through the Affordable Care Act, so that no matter what, in 2020, you keep paying 25% of your share of prescription drug costs and you won't fall into that horrible coverage gap. As always, generic drugs are going to cost less than brand name drugs. So just as you would shop around for any type of insurance, Part C Advantage plans, you're going to want to do the same for Part D plans. I want to talk about that. Hang on just one moment. Okay, so Medicare Part D, I want to talk a little bit about how to choose a plan and some things to think about. You want to consider all costs, not just what the premiums, the monthly premiums cost, but what they'll cover and how much out of pocket you'll be responsible for the medications that you require. When I say consider coverage, I wrote, does it overlap with other coverage? Yeah, do you have another plan that might cover prescription medications? But one thing to really consider is think about the medications that you require. All drugs all drugs require different, they have different rules for being able to obtain those prescriptions. Sometimes a prior authorization is needed. I know on some plans you need a prior authorization for a certain drug, meaning your doctor has to actively write a prior authorization to the insurance company allowing you to obtain coverage for that drug, whereas on other plans that drug might not require a prior authorization. So make sure to check with individually what is going to work best for you, or if you're helping someone out, or if you're a healthcare provider, what prescription drugs matter to that individual, because every plan has a different formulary. Formularies are a list of drugs that are covered by an insurance company. So if your insurance isn't covering a medication, it may be because it's not on that plan's formulary, or it's on a lower or higher tier and is covered at different amounts based on the plan. So check into each Part D policy if you can. Shop around and make sure that you're getting the right plan, because sometimes just looking at the sheer monthly cost isn't enough to really determine how much out-of-pocket expenses a person will have. And then consider convenience too. Which pharmacies are part of the plan? Are there mail order options? What are the hours of the pharmacies available in network for this plan? Just like any insurance, consider everything. So just keep those things in mind. So Medicare Part D premiums are not free. You'll still pay a monthly premium for Part D prescription benefits. I mentioned that the average national premium for Part D was $35.63 per month. You may be eligible for extra help with Part D monthly premiums, co-pays, co-insurance, deductible. Medicare beneficiaries can qualify for extra help if a person is receiving Medicare and has limited resources and income, and of course resides in the United States. What I mean by limited resources amounts to $13,820 for a couple, $27,600. That doesn't count a car or house, but your savings, investments, real estates, savings, stocks, bonds, but not a car and a home. So if you're limited income and resources, you may qualify for extra help. That extra help amounts to about $4,000 a year in assistance. So you won't have to pay the late enrollment penalty if you receive extra help. I'm going to talk a little bit more. This is just one cost savings for low-income beneficiaries, but I'll talk a little bit more about that in a later slide. There's some more cost savings available to beneficiaries, so I'll discuss those. I mentioned open enrollment for general enrollment for Part A and B, but for Part C and D, I also mentioned this a little bit earlier, from now through December 5th through December 7th, if you have Medicare, you can change your Part D plans. If you have Medicare Part A and B, you don't need to think about open enrollment if you're not looking to change anything. If you have Medicare Part C or Part D, because they're all so different, there's an annual enrollment period where you can make changes each year. So if one plan isn't working for you and you have a friend and they've told you about this other plan, or you've done some research, you might want to see if there's a new plan on the market that would be a better match for you at a lower price. If you have an Advantage plan, Part C, or if you have Part D, you can switch plans. During open enrollment, you can actually change from original Medicare to an Advantage plan. So if you have Parts A and B, you don't need to think about this open enrollment unless you're trying to get onto an Advantage plan instead. You can also change from a Medicare Advantage plan back to original Medicare if that's not working for you. You can join a prescription drug plan. You can drop a prescription drug plan. Basically, almost anything in open enrollment. If you miss that, there's also a disenrollment from Medicare Advantage from now through December 7th. Of course, you can change Part D and Part C, but if you miss that, there's this disenrollment period from January 1st through February 14th. If you're in a Medicare Advantage plan, you can leave the Advantage plan and switch to original Medicare. If you switch to original Medicare, you'll also want to join a prescription drug plan to add coverage, because remember, sometimes Medicare Part C plans have prescription drug coverage, and also Part C and Part D, you can switch these up. During this disenrollment period, you cannot switch from original Medicare to a Medicare Advantage plan. So this is pretty limited. Here, you can switch from original to Advantage. You can go from Part A and B to Part C. Here, you cannot do that. This is an Advantage disenrollment period. So you can go from Part C to original, but not from original to Part C. And then you can switch Part C and D. Sorry, that's really confusing and a lot to remember. I don't expect you to memorize all of that, and unless you're looking at it, it's really hard to memorize all of that. But again, these slides will be available. If you have questions on any of that, you'll be free to take a look at these. They'll be this whole presentation will be on our website. All right. How much does Medicare cost? We have a few more minutes here and a few more slides. Part B is going to vary. The standard premium is about $134 unless you make $85,000 a year or more. I mentioned the annual deductible, the amount you have to pay out of pocket before Medicare covers 80/20, and then your 20, the 20% for doctor services, inpatient, outpatient. Part C varies greatly. So I mentioned that Part C plans cover sometimes dental, sometimes prescription drugs, and so the costs might vary greatly. You'll want to shop around. Part C, again, the costs vary, but the average is about $30, $35 per month. And then here are some other low-income Medicare programs. There's the Qualified Medicare Beneficiary programs that will help with premiums and coinsurance and copays. And this program will pay premiums for Part A if you have a premium for Part A, premiums for Part B, and the income limit for this is about $1,000 for an individual, $1,025 per month for the monthly income limit, and then for a married couple, the income limit is $1,374 per month to qualify for this program, and that'll offer some assistance in these areas. The SLMB, Specified Low Income Medicare Beneficiary Program, that's a mouthful, will help pay for Medicare Part B monthly premium if you have an income limit of $1,226 per month, or a married couple of $1,644 per month. And then some Part B premium payment assistance under the Qualified Individual Program if you have an income of $1,377 per month, or married couples with an income of $1,847 per month. If you qualify for Medicaid, you can't get the Qualified Individual Program payment assistance. All right, I sort of touched a little bit on this, but I mentioned about the custodial care. That's not covered by Parts A and B, but what is covered is an unlimited number of home health visits. If a physician's determined you're homebound and that the services are following a physician's prescribed plan of care, and you require skilled nursing services on an intermittent basis, or occupational or speech therapy services, and they're provided by a licensed home health agency, then Medicare covers that. And Part C, you'd have to check the plan to see if it covers home care visits, but Part A and B does. I touched a little bit on hospice and said I'd mention a little more later. So if a doctor certifies and a hospice medical director agrees that a patient's terminally ill, meaning they expect to have less than 6 months to live, and the patient chooses the hospice benefit over standard Medicare benefits, you sign a statement waiving Medicare coverage, then Medicare will pay for 2 90-day periods followed by an unlimited number of 60-day periods. The reason for that is a lot of people get better. They go to hospice and then they sometimes improve. So Medicare will pay for multiple hospice visits if a doctor certifies that a patient's terminally ill, but then you would have to sign and accept palliative comfort care instead of curative care. So when you go into hospice, that ends the curative treatment and begins the palliative treatment. It's your responsibility to know when to sign up, to read everything from Medicare, and you can also have an authorized representative to help you make decision about Medicare. But this is why we're doing this presentation, because the responsibility is on the individual to know what your benefits are. These are your Medicare choices, original Medicare side by side next to Advantage. Just in case people are more visual learners, I know this chart's helped a lot of people to understand what Medicare coverage a person can get. And so if you have a Medicare Advantage plan, Part C, that's the same as Part A and B. And then you can, if you have Part A and B, you can add a prescription drug coverage plan. If you have an Advantage plan, you cannot add a prescription drug coverage plan because they're already included in your Part C. They usually are. Just one second. Okay. And then here's some Medicare resources if you have additional questions. The best way to enroll into Medicare is through the website or by calling this number here, 1-800-MEDICARE, or go on medicare.gov. That way you can see what you're eligible for, such as if you have enough credits through Social Security, which plans would be better for you. These are the kind of things that someone would be able to help you with on this 1-800-MEDICARE number. You can call a legal aid. If you have questions about your plan, you want to try to get in touch with your Medicare plan, you can call the State Health Insurance Assistance Program, which is SHIP is its acronym, and you can contact the CLRC. We can find that number for you if you're unable to find it. So if you have questions about today's presentation, I'm going to stay online for a few more minutes. We've ended just a minute before 1 o'clock, and I'll stay online and see if people have questions for a couple minutes. I'll stop the recording and I'll answer some of these questions, but if you have questions about today's presentation, go ahead and ask. I'll stay online, like I said, for a couple minutes, and then if you have questions about a specific situation and you want to know whether certain benefits are covered for you under a certain Medicare plan, you can fill out an online intake and I can try to answer those questions. I see some people are asking questions specifically about their situation. These are things that might be best if you fill out an online intake so I can get the exact information about your situation, age, where you live, what type of Medicare plan a person might have, and whether you're receiving SSDI, things like that. So I will end today's webinar, and thank you so much for being in attendance, and I hope this was helpful to you. Again, these slides and the presentation will be available on our website shortly after this presentation. So if you came in late or you want to share this with someone, you're free to view our website, but I will stop the recording now and check out some of these questions. Thank you.